Good afternoon. This is Monica Powdell. Today I'm going to discuss about the journal assignment. This week in clinical, I encountered a patient diagnosis with post-traumatic stress disorder that significantly impact my understanding of both psychopathology and psychiatric nurse practitioner role. The patient was middle-aged individual with a history of childhood trauma and recent trigger that has been excreted the symptom, including hypervigilance, intrusive memory, and emotional numbing. What stood out to me was how the patient initially presented with the irritability and guarded behavior, which could easily be misinterpreted as resistant or non-compliance. However, as the session progressed, it became clear that the behavior were deeply rooted in the trauma-related fear and mistrust. This experience challenged my previous accompanying and highlighted the complexity of post-traumatic stress disorder presentation beyond the textbook description. This interaction deepened my appreciation for the psychiatric nurse practitioner in creating a safe and therapeutic environment. I realized how essential it is to approach patients with trauma history using a trauma-informed lens, recognizing that their behavior often serves as a protective mechanism. I became more aware of how subtle cues such as tone of voice and body language can influence the patient's sense of safety. This encounter also enhanced my understanding of post-traumatic stress disorder as not just a cluster of the symptom but as a life experience that affect every aspect of the patient functioning, including their ability to trust healthcare provider. In reflecting on my personal strength, I recognize my ability to remain patient, empathetic, and non-judgmental, which help to build rapport with the patient despite their initial guardedness. However, I also identify a limitation in my tendency to feel uncertain when patients do not respond openly or positively. At time I question where I was being effective, which could potentially impact my confidence during the interaction. This experience taught me the importance of tolerating ambiguity and recognizing that building the trust with trauma patients often take time. My therapeutic use of self involved maintaining a calm presence, active listening, allowing the space for the patient to share at their own pace without feeling pressure. One key insight I gain from this experience is the importance of meeting patients where they are emotionally rather than where I expect them to be. I learned that progress is a trauma care is not always linear and that small steps such as establishing a sense of safety are significantly achievement. Moving forward, I will apply this learning by continuing to practice trauma informed care, being mindful of my verbal and nonverbal communication, and allowing the therapeutic relationship to develop organically. This experience has strengthened my commitment to become a more patient centered and reflective patient in my future psychiatric nurse practitioner role. I look forward to apply this learning experience in future practice as well. Thank you.